Hi everyone, my name is Minh Nguyen and I'm currently a lecturer at Hanoi Medical University. I apologize for not being able to attend the conference in person today, but it is my pleasure to present to you our research titled HIV Testing, PrEP Awareness, PrEP Uptake, and Correlates Among Adolescent Men Who Have Sex with Men in Vietnam. And here are my colleagues who also contributed to this work. So compared to older men who have sex with men, or MSM, younger MSM usually have lower self-perceived HIV risk, but more risk behaviors for HIV infection. They also face unique challenges to HIV prevention and care due to the lack of comprehensive sexual education, lack of family support, and legal barriers due to their young age. In Vietnam, recent data show that 12.4% of young MSM under 20 is HIV positive. We also know that pre-exposure prophylaxis, or PrEP, is a powerful tool to prevent HIV infection among MSM. However, little is known about the prevalence of PrEP awareness, PrEP uptake, as well as HIV testing among adolescent MSM in Vietnam. We conducted this study with two objectives. First is to assess HIV testing, awareness, and uptake of PrEP among adolescent MSM in Vietnam, and second, to identify factors associated with these outcomes. From November 2022 to April 2023, 120 adolescent MSM from 15 to 19 years old in two largest cities in Vietnam, Hanoi and Ho Chi Minh City, were recruited through peer outreach. Inclusion criteria included being 15 to 19 years old Vietnamese, being born biologically male, having had sex with another man before, having a negative or unknown HIV status, and living in these two cities. We excluded those with known HIV positive status or unwilling to provide informed consent. Participants then completed an online survey, which include questions on demographic, sexual behaviors, HIV risk perception and knowledge, HIV and STI testing, excuse me, as well as PrEP awareness and uptake. We use multivariable models controlling for confounders to determine the factors associated with HIV testing, PrEP awareness, and uptake. We also calculated prevalent ratios, and confidence interval. Moving on to the result, as you can see here, the large majority of participants have heard of PrEP before, with only 18% have never heard of PrEP. However, when it came to using PrEP, only 37% have ever used PrEP before. And there was still a large amount of people who have never tested for HIV, which is 42%. As for lifetime HIV risk perception, we can see here that a large majority thought of themselves as having a low risk or even no risk of HIV infection during their lifetime. So the two low risk categories added up to 80%. Also, no one chose the highest category of extremely likely. This table showed results from the multivariable models exploring the association between participant characteristic and HIV testing, PrEP awareness, and uptake. There are blank spaces here because if two variables were not associated in the univariable model, we did not include them in the multivariable model. And all significant association were highlighted in red. The first thing we noticed was that compared to those who think they have some HIV risk, those who thought they might not get HIV at all are actually more likely to have had HIV testing and use PrEP. This might be it's HIV testing and PrEP uptake that made an impact on people's risk perception. So those who already had a negative HIV test or used PrEP before might be confident that they can be infected. Moreover, HIV knowledge was associated with both HIV testing and PrEP awareness, but not PrEP uptake. We also found that those who had an STI test were more likely to have an HIV testing and know about PrEP. And finally, having had sex with another man was associated with HIV testing. So to conclude, HIV testing was associated with HIV knowledge, lower HIV risk perception, STI testing, and having had sex with another man. But only HIV knowledge, STI testing was associated with PrEP awareness, and PrEP uptake was only associated with low HIV risk perception. And even though a majority of adolescent MSM in Vietnam have heard of PrEP, HIV testing and PrEP uptake was surprisingly low. We recommend that qualitative research exploring barriers and facilitators of HIV testing and PrEP uptake is necessary to provide a deeper understanding of this behavior, and future intervention should also aim to increase HIV and STI knowledge and exposure to testing services to promote PrEP awareness and PrEP use among adolescent MSM. Thank you for your attention.